really, really sucks, because one of the things that's going on right now, and I predicted a while ago that Trump was going to crack down on immigrants. And we see that happening now to Chinese international students. Well, you know, it was a Taiwanese-born immigrant, Dr. David Ho, who did some of the most groundbreaking research in the 90s around AIDS and HIV. If we're not going to allow Chinese American and potentially other immigrants from Asia who have STEM skills to come to this country and to work, I think they'll put us further and further behind, right?
Yeah.
And my heart just hurts for people like that, because that's who my parents were. My father came as a researcher. So that's our future flow. That's perhaps people like your parents or your friends' parents. And it really sucks to be in that kind of Cassandra moment, to be the person or to be the community, giving these warnings, donating PPE, being on the front lines, and then to be hated for nothing else. And now we're seeing, even with the testing, because they're able to track the genetics of all of it, a lot of the cases that were in New York actually came out of Europe. And so we'll be curious maybe in 6 months to see, what else that is, and where else that is. But I think, unfortunately, in terms of hatred and discrimination, because I sit on the ADL's Anti-Hate Crimes Task Force, there's a high kind of connection between discrimination and disease, right? Historically speaking, immigrant communities, communities of color have been ostracized for causing diseases, when that's not in actuality true.
And more personally, can you highlight what you believe are the 3 most important things that you've been doing directly related to COVID-19?
Well, so very early on, I was gathering PPE, and then I've been helping some of our elected officials and foundations here, because that's the other thing about folks in the Chinese American and Asian American community, is we were aware that there are better suppliers of masks and worse suppliers of masks. And some of our governments weren't actually vetting the sources of masks. And so I know the state of Missouri had bought $0.5 million worth of masks that were not to spec.
Yeah.
I had been helping people here, not the state, vet their sources of PPE, and just giving them simple advice like, oh, if you're going to buy $5 million worth of masks, you probably want to split up where you're getting that from. And then also, was very early in launching an effort to hand make masks. And then I had connected a number of the restaurants to an effort to donate food to COVID units. And then I think one of the other things that I've done on the political side is to have doctors in qualified fields speaking about infection and the spread of infection. I think it's really, and also connecting the county to doctors in various communities who've been doing the education and the work.
So I know that you advise the American Red Cross of Eastern Missouri. How has that work and other medical work been impacted by COVID-19?
I can't speak for the Red Cross itself. I know that they had a shortage of blood for a period. I think, my husband is better at talking about this, but fundamentally speaking, medicine, right, is based upon doctors and nurses and practitioners being able to touch patients, right? You palpate people to figure out, like if there's pain in the kidney, or, you know, you thump on their back to figure out like where their cough is coming from. And so what the hospitals here have had to do, what medical practitioners have had to do, is to completely pivot that model. So I know that the hospitals here have had to make a lot of changes, you know, change up the rooms, try to figure out which rooms can have oxygen pumped into them, all kinds of things. So the physical layout to how they actually practice medicine. That's like a very broad perspective, and I don't feel comfortable going deeper into details because I am not a doctor, you know, can't make any of those claims.
So in moving forward, how do you think COVID-19 is going to affect the Asian American community? And do you think we'll need to take extra steps to combat COVID-19?
Well, so I made a joke on Twitter that in the early days that people, more and more people were going to adopt Asian customs, like let's leave our shoes off when we come in the door. That's just a general cleanliness thing, but it's also a good practice for COVID-19. And then I also was like, you know, I was like shedding my clothes. I had inside clothes and outside clothes and taking showers after coming in. And I was like, wow, I've turned into my grandma. Also, I'm like saving everything. You know, my cardboard boxes, I'm turning into broccoli collars. And it turns out that these immigrant hoarding things that my parents have been doing might actually be useful. Who knew? And yet I critique them for having like decades worth of World Journal newspapers, because I was like, that is a fire hazard. But you know what? Then I thought about it, I was like, actually, that could be toilet paper. That's on the lighter side. I think historically speaking, the Asian American community, the Chinese American community, the Indian American community, various communities, Korean American community, you saw it with the LA riots.
Yeah.
We tend to be very reactive, not proactive in how we approach things, right? So after something terrible happens, then we kind of organize, like after 9/11, my friends who are at DESI, you know, organized and, you know, got their communities to vote. After the LA riots, the Korean American community in Los Angeles organized. You know, same thing happened after Japanese American internment, unfortunately, right? And so we're in a moment where we as a community can come together, work together, have mutual aid. But I think it doesn't, you know, how do I say this? It doesn't necessarily last, right? These moments of cooperation within our specific ethnic communities, and then, you know, between like the solidarity between Chinese Americans and Japanese Americans or whatever, right? Because historically speaking, during Japanese American internment, Chinese Americans, some of them had buttons saying, I am not a J word. And so the question is, how do we really build and have solidarity and not just be there for each other within our ethnicity or within the Pan-Asian American space, but how do we have solidarity with African Americans, with Latinos, with Muslim Americans? Because I see too often that we're like, oh no, we're being attacked. You know, why aren't people helping us, right? But the better question is, where were we when those folks were being attacked? And these are some of the lessons that I saw during Ferguson and before Ferguson. And the 6 years that I've been here, I've spent not just trying to build within the Asian American community, but also to build alliances outside of the Asian American community. So the census work that I am doing, fill out your census, is very intergenerational within the Asian American community, but it's multicultural outside of the Asian American community. So working in coalition with Latinx, African immigrant leaders, you know, Bosnians, because we're all stronger when we work together. And frankly, the issues of lack of translation, when people call to get a test, those are common to all of us, right? Those are common to, at least in the state, those are common to all of our communities. And um, we just have to acknowledge that. So I think the Asian American community is at a crossroads, right? We can take this as an opportunity to build power and to organize and to support each other, or we can be silent, right? Being silent is always an option. And I'm not the kind of person to be silent. That's not who I am. But I think it'll be interesting to see what people here locally do and what people nationally do. On the very partisan side, I've been part of an organization that has helped to elect over 100 Asian Americans across the country. And so that's how come we have 20 plus people in the Congressional Asian Pacific American Caucus who are able to go and speak for our community and push for better bills, for funding for our communities. But it's really hard here in a place like Missouri because in the state legislature, no one is pushing our issues, right? No one. And I have a number of friends in the state legislature, and they're great people and they're allies, but it's not like we're that top of mind, right? And so my friends who are state legislators in Ohio, in New York, in California, in Kansas, they're able to issue resolutions. They're able to talk about these things on the floor in Connecticut. And we don't have anyone carrying that message. And consequently, when the state does things like decides to spend taxpayer money to sue China over COVID-19, it's just not a good use of resources. If elected officials broadly had more connections with the Chinese American community, we could have been helping them find the right PPE to start with, right? I just feel like it's a gigantic missed opportunity. It keeps being missed. And, I try to connect people and bridge those divides, but it's a lot of work and it requires trust, right? So to go back to that solidarity, that mutual aid, you have to build those relationships way ahead of time before when everyone is in a crisis moment. Because when people are